Hi parents, and welcome! In today's video, we're going to talk about something every parent experiences sooner or later: baby teething. I'll explain what teething actually is, the common symptoms, how you can comfort your baby safely, and a few important things all parents should know. Teething is a completely normal part of your baby's growth, but it can be confusing and stressful when your little one suddenly becomes cranky or fussy. Don't worry. Once you understand what's happening and how to help, it becomes much easier to handle. Teething simply means your baby's teeth are starting to come through their gums. It's one of the early milestones of growth. Most babies begin teething somewhere between 4 and 7 months, though some may start a bit earlier or later, and that's perfectly normal. During this process, the gums become tender and slightly swollen because the new teeth are pushing their way through. This pressure can cause discomfort, which is why many babies drool more, chew on things, and seem a bit fussier than usual. So if your calm baby suddenly starts gnawing on toys and drooling like crazy, congratulations! Those first teeth are on the way. Now, how do you know your baby is teething? The symptoms are usually easy to spot once you know what to look for. You might notice your baby drooling more than usual, and their chin or cheeks may get a little rash from the constant moisture. Many babies chew or bite on toys, fingers, or anything they can grab. It's their way of easing gum pressure. You may also see swollen red gums, and your baby might be irritable, have trouble sleeping, or cry more often than usual. Some parents report a slight rise in temperature, but it's important to know that teething does not cause a high fever. If your baby has a temperature over 100.4 degrees Fahrenheit, 38 degrees Celsius, diarrhea, or other signs of illness, it's likely not just teething, and you should call your pediatrician to be safe. Let's talk about what you can do to comfort your baby safely. One of the easiest ways is to gently rub your baby's gums with a clean finger or soft, wet gauze. This light pressure can really help ease discomfort. You can also offer a chilled, but not frozen, teething ring, a cool spoon, or a clean, cold washcloth. The coolness helps numb sore gums. Just remember, never give your baby anything frozen solid because it can damage their gums. Chewing on safe, firm rubber teethers can also help, but avoid anything small enough to be a choking risk. And don't forget the power of comfort. Extra cuddles, rocking, and calm surroundings can do wonders when your baby feels cranky. If your baby seems to be in a lot of pain, you can ask your doctor about giving an age-appropriate pain reliever, like acetaminophen. Always follow your pediatrician's guidance for the right dose. And here's a very important safety note. Avoid teething gels or creams that contain benzocaine or lidocaine. These can be dangerous for babies. Also, never use teething necklaces or bracelets, as they can cause choking or strangulation. Homeopathic teething tablets are also not recommended due to safety concerns. There are a few myths about teething that parents should be aware of. First, teething does not cause high fever, severe diarrhea, or major illness. If your baby has these symptoms, it's best to have them checked by a doctor. Second, every baby is different. Some babies sail through teething without much fuss, while others may struggle with each new tooth. Either way, this phase will pass. It's also a great time to start good oral hygiene habits. Even before teeth fully come in, you can gently wipe your baby's gums with a clean, damp cloth. Once the teeth appear, start brushing them softly with a baby toothbrush and a tiny amount of fluoride toothpaste. You may also notice that your baby eats a little less while teething. That's okay. Offer soft, cool foods like purees or yogurt if your baby is old enough. And always remember, if your baby's symptoms are severe, last too long, or include fever and loss of appetite, talk to your pediatrician. It's always better to check. Let's quickly review. Teething is a normal milestone in your baby's development. The main signs are drooling, gum swelling, chewing, irritability, and sleep changes, but not serious illness. You can help your baby feel better by massaging gums, offering chilled items, giving extra comfort, and keeping their mouth clean. Avoid unsafe products like gels, necklaces, or homeopathic tablets. And most importantly, be patient and gentle. You're doing great, and your baby just needs a little extra love while those tiny teeth make their way in. thank you for watching. I hope this video helped you understand what's normal during teething and how to make your baby more comfortable. If you found this helpful, don't forget to like, subscribe, and share with other parents.